rare diseases themselves are rare, but as we know, we're learning more and more about our genome, and so rare diseases as a whole is actually quite common. And if a patient is not fitting your classical presentation, start to look for the zebras, especially if there's treatment out there. So if it's in your specialty in neurology or ENT, it's important to understand those zebras and those zebras that have treatment, because the earlier we can get to those zebras and treat them, maybe we can alter their course. So for example, in Fabry disease, if you're an eye doctor and you notice cornea verticillata, that should prompt you to say, do you have any kidney problems? Do you have any acroparesthesias? Does this child have Fabry disease? And that's important. Even though that eye finding is completely benign and insignificant in the patient's function, it is a stigmata of a disease that's X-linked, and that could unlock multiple family members with this disease. And if we can get to them sooner, then we can prevent end-stage renal disease and the need for a cardiac transplant. So it's important to know your differential within your specialty and to think of the rare diseases and consider testing for it. It's easier to test today. We can send enzyme, we can send DNA. It's less invasive. We don't necessarily need to do muscle biopsies, skin biopsies, kidney biopsies to get these diagnoses. We can actually just send a simple blood test and look for these diseases.